Hi, Bill Howatt, Mental Health COVID-19, Conference Board of Canada. Today I'm going to have a conversation with you about what if you capture COVID-19. I'd like us to prepare for that reality and to understand how we also can ensure that we mitigate our risks throughout that process. And what I want you to be thinking about, I'm going to use a mnemonic today called ILL. First, I want you to, the I would be initiate your plan. Initiate your plan is going to be about prevention. The one way to reduce your chance of getting this is to follow the instructions the government has given us all and ensuring we're doing our social distancing, we're washing our hands, vigilance. We're also paying attention to the people we come in contact with, making sure that in the event that you did get COVID-19, so you wouldn't have any stigma, shame, or guilt about anyone else, you're paying really close attention now who you're coming in touch with, so that if there's any communal, you'll know whether it may be from you or to them. So your part of your prevention right now is paying attention to your patterns and other people's patterns to ensure that you're doing all you can to mitigate. The other thing is, in the event that it happens to you, is to make sure that you already have your preparation plan in place in regards to food supply, medical supplies, painkillers, things that you would benefit from having at home. Ensuring that you also think about potentially, and none of us like thinking about this, is ensuring that you have your readiness plan in regards to if you were sick and you needed someone to take care of your children for 14 days or your work or etc. What is your contingency plans? Start having those things in place so that you're covered up for your work, your family, your priorities. It is inconceivable for some of us to actually think about this kind of stuff, but the one thing about being a human being, we all know that death is a part of our journey, and our death doesn't always come when we want it. And fear of dying is an existential crisis many of us have, but that doesn't stop many of us from being clear of making our wills, making sure our personal things are in order. That's a part of our preparation part of this. And then our resources, which I'll talk more about in the when I get to the L around isolation and what we can do around insulating for isolation. And what's really important in your initiating your plan is to get your psychology ready and get your mental health ready and to be clear about the facts. I do not want to actually play COVID-19 down. It's a very serious disease and it's taking many people's lives in our country and other countries that are premature, that don't need. There's vulnerable populations that may be more at risk. However, all of us are at risk. But here's the facts. The facts are the majority of us will not die from COVID-19. The fact is some of us will be asymptomatic. Some of us will have mild symptoms. Some of us will have a little more symptoms. And some of us will end up in the hospital. About 7% of us will get fairly sick that may need to be hospitalized. Around 3% of us would probably be at risk to end up on respiratory support systems, the respirators that you're hearing about. And between 1 and 2% of everybody that gets this will die, whether they're on respiratory system support or not. So the reality is vigilance in this, but being aware and being able to put that hope structure in place that if you do get COVID-19, it doesn't necessarily mean it's a death sentence. My concern is that with the media and where we're going, if we don't start having conversations, if I get this, what does that mean? It can become overwhelming. Let me share a personal story. I ended up when I was 50 years old, was diagnosed with a brain tumor. When I was diagnosed with a brain tumor, it took me about 2 days because I was not prepared, completely overwhelmed, and very, very upset about the whole situation. Never had a plan on when I turned 50 to get a brain tumor. Didn't know what that meant until I got the information from the doctor what an acoustic neuroma was. I was completely overwhelmed. Once I got that plan about what I could do with an acoustic neuroma, knowing that there was less than a 2 to 3% chance of me ever dying, that was able to remove my symptom load and my stress load and help me get out of fear because I realized that yes, I could die from this brain tumor and still can after 6 years, but I can't control it. All I can control is my micro decisions of what I'm doing. So it's as hard as it is for us to get our head around, preparing for COVID-19 is important. Now, the L. If you happen to start to feel sick, and you start to feel sick, well, because in your resource plan and in your preparation, you would have already identified the proper websites, for example, for your symptom, the Health Canada symptoms, your provinces about symptoms. You would be checking your symptoms against those approved, accredited websites that are well trusted. You could be calling, you already have in your preparation plan about calling the nurse's number, 811, your physician numbers, those numbers. You would be calling, giving those folks your symptoms, checking your symptoms. Just because you have a cough and a runny nose doesn't mean you have COVID-19. This is a time of year where we're in natural flu season. There's all kinds of things, allergy season starting. We don't want to start hallucinating. We need to be objective. We need to be factual. We give the professionals the facts. They will help us determine if we need to be tested. At that point in time, once they test you, they'll determine your risk profile. Once you get tested, they will help you determine where you're at. And based on your symptoms, many times people will be able to manage these symptoms from home. Now, the challenge being is in the preparation is the insulation for isolation. It's be really, really important that you have a plan for your isolation. You need to get your head around that if you do get COVID-19, you could be in isolation for 14 days or more at home. Like myself in this apartment in Ottawa by myself, but I still have my food supply. I still have my social connections. I still have things that I can do as long as you can feel you're okay. Because one of the key parts of your plan for getting well, and it's important for you to keep your mind on this. If you do start to get sick, managing fear is important. And talking about your fear is okay, is because if you start getting fearful, that'll impact your immune system. And if it impacts your immune system, meaning you can turn off your immune system if you have your fight or flight, fear doesn't do you any good in this one. What we really want you to do is start paying attention to what you can control, and that is your positiveness, your attitude, keeping your mind on the facts. And until you get the diagnosis from the professionals, you don't know if you have COVID-19. If your tests come back, you have COVID-19, that still does not mean the end of the world. It means you need to be vigilant, follow your protocols, and weather the storm as long as you can. The next L, if you become sicker to the point where the symptoms start to come overwhelming, look to the future. The last L is look to the future. Many times, if you've ever been really, really sick before, I have had spinal meningitis one time. I had a ruptured appendix one time. I was in the hospital for a week. It sucks. And what happens is if you can focus on the fact is that the healthcare system is going to do all it can for you. And part of it's going to be our positive attitude, managing our fears, being aware of those facts, holding those facts that many of us drive cars every day and we wear seat belts and many of us are very okay. It is well as overwhelming as it can be. The facts are on your side. If you do get COVID-19, you follow your protocol, pay attention to social isolation, communication, doing things, keeping your spirits up the best you can is important. Now, if you get really at the point where you're becoming concerned, one thing you may want to consider is, reaching out to your family and telling them your concerns, your fears, and those kind of things, leveraging mental services, psychological support. If you're struggling with your emotions, all that stuff is on board and it's fine and it's okay and it makes sense. But again, going back to your initiation plan, you know yourself better than anybody. If you're a warrior or anxious, have a plan in your plan about who could you call if you were a crisis. What are the crisis lines? What are the EAP supports? You will each need to develop your own initiation plan to prepare you for mitigating your risk for getting COVID-19. If you do get COVID-19, how you could go through and go through the different parts of this process to ensure that you're okay. I believe this is a conversation that we need to start to have with our families. We need to start talking with each other about it. If you capture COVID-19, if those are ifs, if you get it, there is that risk. If you get it, how will you cope? How will you support families? What will you do? And have your contingency plans to start talking this out, writing out your action plans. The wrong time to prepare for a crisis is when you're in it. As difficult as this is, it's the right time right now when you have your health is to start to talk about all the different issues. Emotion management is key. Managing fear is key. Paying attention is key. And the last thing I'll say to you is that these kinds of conversations, as difficult as they are the kinds of conversations that can give you a place to focus on so that you're in times of uh, like this where you can be scared, is you can recenter your energy and refocus to help mitigate your risk and anxiety that you could go through this kind of process. Doesn't mean it's not going to be hard. Doesn't mean it's not going to be scary if you end up in a hospital, if you're at the point where you're that 1% and you have to go in that uh, machine to save your life. Know that there's still a high chance that you're going to come off that machine. Stay positive as you can. Believe in it. Make sure that you've shared your concerns with your family, even if you had a chance to write a note to your family. Um, it's a very lonely, isolating process because your family members can't be with you. Understand that they just because they're not there physically, they're there. We're all there. We need to be a time to realize that this is a point in time that as human beings, our vulnerability is okay. We just got to talk about this, and that's what my goal is for us to talk about it. And whatever is right for you, is to start thinking about the what if, so that if it does happen to you, you have your plan for the different levels. And that's what I'd like you to think about today. And not every day is going to be a heavy topic, but I felt it's time now to have this conversation with you. So thinking about all of you and wishing you the best. Stay vigilant. Keep washing your hands. Next 2 weeks, folks. Next 2 weeks. Let's follow the plan. It's super, super important. Let's let's together protect ourselves and protect others, one day at a time. Hi, Bill Howatt here. Hopefully you're finding these videos of some value. If you'd like to share these, on the lower right of your video, there's a icon you can click. You can send it through your social media feeds. Join the Conference Board of Canada social media feed so we can keep you up to date. And if you have ideas or suggestions, please leave your comments so we can consider them. If you have things that you'd like us to speak to or talk to, I certainly will try to do all I can to help out. So with that, have a wonderful day.